Hi, I am Kyle Celine Dorado, Queen Mabalacat City 2019, and I'm here now returning for my nose engine enhancement procedure that I did for like about 2 years now. And now that I've returned, I am going to try the threads. Yeah, if you want to watch the procedure, please don't forget to like and subscribe, click the notification bell, and of course, watch the video.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new product that we will present to you for the non-surgical nose enhancement. But before that, let's all welcome again Miss Casey.
Hi!
Welcome back, Casey. So we had an episode like more than a year ago where we featured Casey for a treatment also on the non-surgical nose enhancement, right?
Yes.
And she's following up with us, and right now I could still see that good nasal projection. How was it naman, Casey? So far?
Sobrang ano po talaga, as in, I think it really stayed longer.
Yeah.
than usual.
Yeah, that's a good thing. Somehow the product that we use for Casey, it stayed longer, right? And I could still appreciate that nasal projection there. Okay. Now, we just wanted, of course, to boost the effect of that non-surgical nose enhancement. Because right now, these kinds of procedures, I could say, they give a semi-permanent effect whereby they will stimulate your own natural tissue to form those fibrous network of connective tissues. Exciting, right?
Yeah.
Kahit na hindi na tayo magpa-surgery, we could still achieve that natural result. And of course, it's not altering your identity, that it is still you and you won't look different na.
Just enhance.
Enhance, exactly. Kasi, Casey, very beautiful. And a beauty queen. Soon to be beauty queen. Okay, so it's just highlighting those beautiful features of the face. So, specifically, the nose region. And then, we will also add enhancement ng ating chin area, plus also somehow the face contouring. Because, you know, we wanted to stay within the rules of ratios and proportions, whereby we wanted to balance all the features of the face. So, we have the upper third, middle third, lower third. So, sa lower third, we'll also work on the masseter plus the chin. Because we noticed that the vertical dimension here is less, right? So, we somehow wanted to make it like balance with the rules of proportions. Okay? Before we do the procedure, Casey, do you have anything to ask or something in your mind that you wanna add? Anything?
I think, ano po, let's just jump right into it.
Yeah, because I
I'm
think
really
she's
excited
excited.
too.
Yeah,
Excited.
and she trusts na ang CSA.
Yes, exactly.
Trusted na
Opo.
daw ang hands ng CSA. Parang ano yan eh, every time people come to our center, parang, ay, pinagkakatiwala ko na lahat kay Dr.
Just
Contessa.
little to no pain. So.
Yeah, and that's an important thing kasi others are scared of any pain, ano yung mga needles, right? And as much as possible, we want it painless. And of course, the procedure is also comfortable. It's not really giving you that torturing moment. Okay, so ano kaya ang ating bagong procedure and bagong product material ating ipakita sa pagbabalik ng CSA Medical Aesthetics? So we will now introduce a new product for our non-surgical nose enhancement. And this time, we will be using a so-called PLLA thread. Okay? So in the previous episodes, we've been using PDO and PCL. So right now, we have the PLLA, the so-called scaffold threads. So I have here a new line of our thread. So poly-L-lactic acid, and it is in a scaffold feature. So meaning to say, the thread had been like in an intertwined structural appearance. Okay, so it's better for lifting, for volumization, especially for those who really lack that definition and projection of the nose, or they really have that inadequate height. Okay, so for those individuals who don't want to have dermal filler, this is also the thread that you can use. Plus, PLLA lasts longer than the original PDO or the other thread that we had used. Okay, so we will be using 4 to 5 threads for Casey on the dorsum of the nose. So before any procedures, of course, you have to clean the area, disinfect it, and then we did apply topical lidocaine a while ago. And then also, I injected a lidocaine in the infra tip just to numb the area for our entry point. And then I did a puncture using our gauge 18 or gauge 19 needle just to have that entry point. So I'll pinch the nasal tip and then insert this cannula here. It's a 21 gauge cannula with a length of a 60 millimeter. Okay. I'm just gonna thread this towards the radix. And take note, we had filler in the past, and I just noticed that the filler is still there actually. So right now, we're gonna just enhance the bridge again. Okay, so just glide it towards the radix. I'm just gentle because there's actually a resistance already because we did an injection of the filler in the past. Okay, so there you go, and then just towards the radix. Okay, again, we're using a different kind of nose thread, PLLA. So just glide it towards the radix. Again, just gentle. It's 21 gauge 60 millimeter cannula, and we have scaffold type of threads. So the type of thread actually is PLLA arranged in a scaffold manner. So just up to the radix, and the last one. And after enhancing the dorsum, we can still project the nasal tip. Okay, so up to the radix region, just glide it towards our uppermost part. Okay, so just a little bit of a resistance. So actually, for those people who already had some non-surgical nose enhancement, we feel something so-called resistance. So we have done the dorsum using our PLLA, and now we'll proceed to the tip projection. So I have shorter threads here, and I'll pinch the nose again and insert this. For this part, I actually prefer using PCL because I need a thread that is softer and more flexible. Okay, so for my tip columella projection, so I have here a short thread to enhance our columella or the nasal tip area. Okay, so that's our non-surgical nose enhancement for Casey. So it's actually her second treatment for the non-surgical nose. Now we will also improve the chin area. Okay, so I've mentioned a while ago we wanted to correct the vertical dimension. So we are doing the so-called checking of the rickets line here. Okay, there you go. So the tip of the nose, the lower lip, and then the chin. So in this line, the chin is not meeting the line. So we need to do projection of our chin. Aside from the anterior projection, we need also elongation. And so clean the area. Okay. Let me just change my gloves because I touched a stick there. So important to maintain a sterile environment, asepsis, antisepsis. And there you go, because we will be injecting the chin region. And for the chin, I'll be using my volume filler because I want to really volumize the chin area. So we'll start with the anterior projection. So I make a center line there and insert the needle onto the anterior aspect of the chin onto the bone, the so-called mentalis bone, and I'll insert half of this. So just for the anterior projection. Then after that, we will be doing the so-called chin elongation. So she needed to have this chin improvement, chin augmentation, just to balance with the proportions of the face. Okay, so I'll be doing now the elongation part. So inferior to that, onto the symphysis menti, the bone, there you go. Then a little bit of an aspiration and push the product material. So this is actually a procedure that should be done or administered only by the licensed medical or licensed aesthetic physicians. Okay, so we're using injections, we're using needles. So only doctors with training on aesthetic medicine are the ones qualified to perform such procedures. Okay, so I use 1 cc of my hyaluronic volume filler. Then I also wanted to improve the so-called jawline area here. So we wanted to somehow reduce the width of the face, the lower third here. So I have the botulinum toxin to reduce the muscle here. So some women, they have this very dominant or very strong masseter. So we just wanted to slim it and to somehow make the face more feminine. For women, we wanted to either have an oblong shape or an inverted triangle or a V-shaped kind. And for men, actually, it's more of a masculine to have a square shape. So we wanted to somehow reduce this masseter here. Okay, so I'll use a botulinum toxin and I'll be injecting onto the masseter. So you know the borders that we respect here. So for the beginners, for the novice, we make a horizontal line from the corner of the mouth to the tragus and then a vertical line following the anterior border of your masseter muscle. So have a bite, Casey. So like injecting into the belly of the masseter muscle. So I'll be giving like a few units of this one. Actually, Casey had done this in the past. So this is just a repeat treatment. Okay. For some people, genetically speaking, they really have a dominant masseter muscle. So 3-point injection there. So for the novice, again, you make your delineations, your markings. The horizontal line like that and the vertical line in the anterior border of the masseter. Same thing on the other side. Okay. So for those people who've been doing this for a long time, they already know the anatomy. You know where to inject. You know where to insert our product. So I'm using a botulinum toxin. So I'm just careful there. And last one. And so we are done with our non-surgical nose enhancement using PLLA, chin enhancement using our hyaluronic, and the masseter reduction using our botulinum toxin. Will show the result when CSA Medical Aesthetics return. And we're back, mga ka-CSA. So we'll now show the result to Casey. So here is our mirror. Casey, look at the result. Yan. So I'm amazed also. So actually, this is the first time to use a PLLA scaffold type of thread for the nose enhancement, and I can see the immediate result for Casey. So this is indicated for those people who really want that definition, that really obvious and really like a surgical result already. So I can see the change in the nose contour, the nose shape, and it's a lot better. For me, looking at Casey, I would really say I'm amazed. Casey, what's your reaction? Right.
I'm really surprised po.
Yes.
Sobrang drastic.
Yes, this one is really drastic because we use a different type of material. Again, this is PLLA or polyl lactic acid, and this kind of thread will last longer than the other, the PDO that we have used in the other episodes that we had. And for Casey, actually, we did like a filler injection more than a year ago. And when I was doing the insertions of those threads, I could still feel the previous dermal filler. So there was still a remnant from that. And this one, wow, I'm really okay na, pwede na. O, diba? So there's really this projection of the radix part, and the tip was really more, rather there's an increase in the height of the nasal bridge as well as the nasal tip, and we were able to really narrow the sides of the nose because a while ago the sides are really flaring, but with the tip projection using our threads, it went narrower. And for the chin, also we use hyaluronic dermal filler just to improve the rickets line and also give that a better dimension, or rather the anterior projection as well as the elongation. Now for the masseter botulinum toxin, we will still wait for 2 weeks result of that one. So with the sides of the face, we'll have a follow-up. We'll check on the slimming of the masseter or the chewing muscles. Okay, thank you, Casey. Thank you so much. Although, of course, with the insertion of the threads, somehow you feel those threads kasi they're thicker, and we use Scaffold. Plus, these kinds of threads are robust, or really they will give a drastic result. They're more of the firmer or harder. So it's not like the PCL that's soft and flexible. This one is a stronger type of a thread. It's really thicker and more volume. So this is a thread for those who want to have more volume on their nose and more projection, more height. Because I still have other clients, they just want subtle or not so obvious. So we can use the other types of material. But for those clients who wanted really obvious or a dramatic change, very noticeable change, we can use the PLLA Scaffold type of nose thread. So I think it's your first time to have heard of that kind of a product for the nose enhancement. So meron na naman tayong bagong in-introduce sa ating mga taga-subaybay. And so far, how was the experience naman, Casey?
I think po, honestly, parang I think it did something dito. Parang mas nag-lift yung projection ng lips ko.
Correct.
I don't know if it's just me, but I really felt like my lips, my upper lip especially,
Yes.
it's like it's more formed and parang mas nag-lift.
Exactly.
But I felt
parang it has an indirect effect also on the upper lip region, because when we projected the nasal tip as well as also fill in the columella with that type of thread, then somehow there's like this probably like a movement of those tissues in the upper lip region. Okay? So parang may indirect effect nga din pala sa mouth area. So something was also improved there. And probably it's because of the chin also. Because we did nose and chin, so somehow, since yung sa gitna, yung center, parang lalong na-emphasize yung beauty ng lips ni Casey. Right? So parang we're also doing like a procedure not only for just the nose, but we did also improve the other parts of the face like the chin as well as the sides of the face or the angle of the jaw. Okay, we will still see the result of the masseter. So probably Casey will still be a guest, right? So she will still visit us. Oh, ayan. So thank you, Casey. Do you have any like a social media account that they could reach you and probably ask you about this experience today? If you could share a little bit to them, it could help also.
Yeah, you can direct message me on Instagram at Celine Kyle D or sa Facebook account ko po, Kyle Celine Dorado.
Yan. At sa inyo na mga nagtatanong, you can also direct message me at our CSA FB account or page. We have the CSA Medical Aesthetics. We also have the Instagram, CSA Medical Aesthetics, email address, csaskinclinic@yahoo.com. And our clinic is located here at the Infinity Shop, Francisco G. Nepomuceno Avenue, Pulong, Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Sa inyo na gustong panoorin yung dating episode ni Casey, just look at our YouTube channel, Contessa Salvador. So, maraming salamat po. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.